Welcome to our deep dive into the pharmacology of amiodarone, a powerful antiarrhythmic medication used in the management of various cardiac arrhythmias. Whether you're a healthcare professional, a medical student, or simply curious about how this drug works, you've come to the right place. Today we'll explore the intricate mechanisms, pharmacokinetics, therapeutic uses, and potential adverse effects of amiodarone. Amiodarone is an antiarrhythmic medication used to treat and prevent a variety of cardiac arrhythmias, including atrial fibrillation, atrial flutter, ventricular tachycardia, and ventricular fibrillation. Below is a comprehensive overview of amiodarone pharmacology. Mechanism of action. Amiodarone works primarily by prolonging the action potential duration and the refractory period of cardiac myocytes. It achieves this through several mechanisms. 1. Potassium channel blockade. Amiodarone inhibits potassium channels, which delays repolarization and prolongs the cardiac action potential. 2. Sodium channel blockade. It partially blocks sodium channels, reducing the rate of depolarization in cardiac cells. 3. Beta-adrenergic blockade. Amiodarone has beta-blocking effects, which help to reduce heart rate and myocardial oxygen demand. 4. Calcium channel blockade. It also blocks calcium channels, reducing the force of contraction and slowing conduction through the AV node. Pharmacokinetics. There are 4 phases of pharmacokinetics. 1. Absorption. 2. Distribution. 3. Metabolism. 4. Excretion. 1. Absorption. Oral absorption of amiodarone is variable and can be affected by food. Bioavailability ranges from 35% to 65%. 2. Distribution. Amiodarone is highly lipophilic and extensively distributed in tissues, particularly adipose tissue, liver, lungs, and spleen. The volume of distribution is large. 3. Metabolism. Amiodarone is metabolized primarily in the liver by cytochrome P453A4 to an active metabolite, desethylamiodarone. 4. Excretion. The drug is excreted mainly via the biliary route with minimal renal excretion. The half-life is extremely long, ranging from 20 to 100 days, with a mean of about 58 days. Therapeutic uses of amiodarone include its indication for irregular heart rhythms. First, let's talk about ventricular arrhythmias. Amiodarone is effective for treating life-threatening ventricular arrhythmias such as ventricular tachycardia and ventricular fibrillation. Secondly, it is used for rhythm control in atrial fibrillation and flutter, especially when other treatments are ineffective or contraindicated. Adverse effects. Amiodarone is associated with several potential adverse effects including 1. Cardiovascular, bradycardia, heart block, QT prolongation, and torsades de pointe. 2. Pulmonary fibrosis and pneumonitis. 3. Hepatic, hepatotoxicity, elevated liver enzymes. 4. Thyroid hypothyroidism or hyperthyroidism. 5. Dermatologic, photosensitivity, blue-gray skin discoloration, neurologic, peripheral neuropathy, tremor, ataxia, ocular corneal microdeposits, optic neuropathy. Drug interactions of amiodarone. It interacts with several drugs primarily through inhibition of CYP3A4, CYP2C9, and P-glycoprotein. Important interactions include 1. Warfarin. Increased risk of bleeding due to inhibition of warfarin metabolism. 2. Digoxin. Increased levels and toxicity of digoxin. 3. Statins. Increased risk of myopathy with certain statins metabolized by CYP3A4. 4. Other antiarrhythmics additive effects can increase the risk of arrhythmias. Monitoring patients on amiodarone. It requires regular monitoring for potential adverse effects. Liver function tests, baseline and periodic, thyroid function tests, baseline and periodic, pulmonary function tests, baseline and for symptoms of pulmonary toxicity, ECG, regular monitoring to detect QT prolongation and arrhythmias, ophthalmologic exams, baseline and for symptoms of visual disturbances. Summary. Amiodarone is a potent antiarrhythmic agent with a broad spectrum of activity and complex pharmacokinetics. Its use requires careful monitoring due to its extensive adverse effect profile and potential for significant drug interactions. Feel free to ask any questions in the comment section. Thanks for watching. Don't forget to subscribe to our channel.